Well, hello. My name is Jason Eibling, and I'm a physical therapist on post-op day one from ADR at L4-5 and L5-S1 by Dr. Rasouli. So just checking in. I'm not really a Facebook poster much, but was thinking maybe people would want to hear a physical therapist's perspective on what they're feeling while it's kind of in the moment. So uh, I've had, for a history in physical, I've had back problems for about 25 years since loading some boxes in college and did a disc herniation at L4-5. Treated that uh, conservatively, managed it pretty good until 10 years ago when I was doing a slalom water skiing course and actually blew out the other side, L5-S1, because I'd done so much work to decompress the other side. I kind of weighed on the lower disc a lot. So, had a mini for that one, a minimally invasive surgery to just to get rid of that disc problem, and they cleared that out. It lasted me 10 years, and then just started getting bad in June, and by July, I had a compressive problem and a radiculopathy down my left leg that I couldn't resolve. So started the process of fusion versus artificial disc replacement. Settled after some um, research, settled on Dr. Rasouli. Very happy that I did, and now I'm post-op day one. About I think a 2.5 hour procedure yesterday, and so forgive the way I look, but that's kind of rough. Flew out to Beverly Hills from Ohio, and rough night last night. Tough time getting out of the recovery room. I had to go through a bit of brutality to get through those 2 days before the flight and a 5 hour direct flight. So I was pretty inflamed by the time they put me under the knife. So surgery went well, and they got everything. The fitment apparently is pretty good. They've called to check on me today already, and that was nice. They feel pretty good about my prognosis moving forward. I've got a follow-up in 3 weeks and then another one in 3 months that will be with Dr. Rasouli. And hopefully I'll be cleared then, hopefully to get back to some downhill skiing in the following winter, but hopefully some surfing and water skiing, maybe just some light water sports this summer. So not sure what else would be valuable to those that are watching other than I had some atrophy in my left leg, and they want you to walk, which does alleviate the pain, which is kind of ironic in that walking around has actually made the paresthesia kind of go away and the pain go away as opposed to laying or sitting. I figured sitting would not feel good, as it's not felt good for a long time, but I did come out of surgery with no more radiculopathy in my left leg, which was my primary complaint down the S1 radicular path. And I had a lot of muscle fasciculations and a lot of dermatomal pain and typical numbness and tingling and needles. All that is gone. I have a little bit of paresthesia left in my left foot, but it was just gone instantly coming out of surgery. But the low back pain is pretty severe on both sides. So just trying to manage that. And last night they did give me some pretty strong pain meds, so I did get some Percocets because I was 10 out of 10 coming out of surgery, and it took a while for that to clear. They did give me some injections. Did a really nice job in getting all the care that I needed and all the pain medication that I could have asked for to try to get myself to this place. So my wife and kids are out walking on the beach in Santa Monica, which is where the Airbnb is. I've been able to take a minute here to myself. Been able to walk throughout the night every 2 hours. Been able to walk, about 100 feet at a time. Again, not really much pain with that. Just trying to be really cautious. I did give myself a little twinge on the right side. Probably strained a ligament a little bit, just because I have so much atrophy and I'm kind of unstable walking right now with my left leg. So I'm going to have to watch out for that. Use some heat on my back. I've been using ice on my belly. and generally speaking, making good progress. So just a 5-minute update that I might post on my YouTube page, and we'll see if I feel up to it. Maybe I'll just kind of post a day by day so people can get a sense for what the symptoms are. And if you'd like to know anything specific, feel free to push a question into my comments. I'll try to do the best I can to answer it. Again, I'm a physical therapist from Ohio, and I flew out to Los Angeles, California to Dr. Rasouli, Alexandre Rasouli, who's done a nice job with my care.